neurologic abnormalities. While such findings may alter the focus of an assessment, for teaching purposes, we will proceed with a full assessment, beginning with the cranial nerves. Cranial nerves emerge from the brain rather than the spinal cord, with the first 2 pairs emerging from the cerebrum and the other 10 from the brain stem. Abnormalities in function can be related to congenital problems, as well as occurring due to such things as head trauma, stroke, and toxins. All abnormal findings should be reported for physician follow-up. Olfactory nerve function is usually tested only in patients who report a loss of the sense of smell, those who are suffering from head trauma, individuals with an abnormal mental status, or when an intracranial lesion is suspected. Testing is done by having the person sniff familiar, non-noxious smells. If the substances to be smelled are labeled or obvious by appearance, have the patient close her eyes. Occlude one nostril and have the patient smell the first scent and name it, then occlude the second nostril to repeat the test on the other side. Coffee, an orange, vanilla, and peppermint are examples of common scents. Ask the patient to identify only 1 or 2, as repeated tests can result in temporary inability to tell one smell from another, giving inaccurate results. Sense of smell does often diminish with age, but an asymmetrical loss should be reported, as this is abnormal. Testing of visual acuity would be done next. This skill is detailed in the program on head, neck, and throat. The oculomotor, trochlear, and abducens nerves can be tested together in the following manner. First, visualize the palpebral fissures, the elliptical opening between the eyelids, which are usually approximately equal in height and width. When the eyes are closed, the lids should fully cover the eye, and when open, the upper lid normally covers the top margin of the iris. Darken the room, and using a flashlight, check the pupillary light reflex. Bring the light in from the side and flash it quickly into one eye. The pupils of both eyes will normally react briskly and equally. Repeat on the other side. Also, note if there is any droop in the eyelids, which is called ptosis. Adjust the lights to a normal level before proceeding with the next part of the exam. Assess the extraocular movement. Ask the patient to follow your finger or light as you move it through the 6 cardinal positions of gaze. Observe that the eyes move smoothly from point to point and that both eyes track equally. Mild nystagmus, a rhythmic, usually side-to-side movement of the eyes, may occur normally at the outer reaches of the gaze. However, the presence of nystagmus when eyes are looking forward, or gross nystagmus in any range of gaze, is abnormal. If nystagmus is observed, note if it is pendular, meaning moving back and forth equally, or if it is a jerk to one side and slower to the other side. How rapid is the movement? And is it mild, moderate, or coarse in amplitude? Finally, what is the plane of the movement? For instance, side to side versus up and down, rotary, or a combination of these? And is it constant or does it fade? A full eye exam will be demonstrated in our program on the eye, ear, and nose. The trigeminal nerves have 3 divisions: the ophthalmic, maxillary, and mandibular. Begin by testing the strength of the muscles controlling mastication. Have the patient clench her teeth, push down on the chin. Normally, she'll be able to resist having her mouth open. Palpate the temporal and masseter muscles. They should feel equally strong. Now, test the sensory function of the nerve. Have the patient close her eyes, then lightly stroke the skin using a cotton wisp at the forehead, cheeks, and chin. Have the patient tell you each time she feels the wisp. Testing the corneal reflex by touching a wisp to the cornea is now not routinely done. Current evidence does not show this to be a useful test. The facial nerves are responsible for much of facial expression. Ask the patient to smile, frown, lift her eyebrows, show her teeth, and puff her cheeks. As she does this, look to see if the movement is symmetrical, asymmetrical, or reduced, and if there is any facial droop. Any of these can indicate weakness of the facial muscles, injury, or loss of function, such as from a stroke. Sensory function of this nerve is not tested unless facial nerve injury is suspected. To test facial nerve sensory function, touch a cotton swab soaked in something sweet, sour, or salty to the tongue and ask him to identify the taste. The acoustic nerves are tested by assessing ability to hear normal and whispered conversation. A full ear exam is demonstrated on the program on the eye, ear, and nose. The glossopharyngeal and vagus nerves are also tested together. Assess motor function by depressing the tongue with a tongue blade and have the patient say ah or yawn. The uvula and soft palate should rise in midline.
Just swallow for me. And do you have any difficulty swallowing? No, not at all. Okay, very good.
Full assessment of the function of these nerves, including swallowing, is usually done by occupational and speech therapists. The spinal accessory nerves moderate movement in the area of the neck and shoulders. Observe the sternomastoid and trapezius muscles for equal size. Check for strength by first asking the person to attempt to turn her head right and then left against the force of your hand. Then place your hands firmly on her shoulders and ask her to shrug against the resistance. In both tests, movement should be equal and strong. Finally, the hypoglossal nerves are associated with the tongue. Assess the tongue visually for signs of tremors and of wasting. Movement and balance are modulated by the motor nerves of the cerebellum. Abnormalities in their function often directly impact the activities of daily living. Begin this portion of the exam by observing the individual's gait. Have her walk 10 to 20 feet, turn, and walk back to the starting point. A normal gait is smooth, coordinated, and free, with coordinated opposing arm swing and a step length that is appropriate to the person's height